In Scotland, we've been very keen to tackle the problems caused by very cheap alcohol, which is a relatively new thing in Scotland. Really, from the 1980s onwards, we saw an influx of very cheap, mostly UK-produced alcohol that we saw having a big effect on patients, increased rates of alcohol-related disease and deaths. And so the Scottish Parliament passed a law to ban the sale of very low-cost alcohol. We're very keen to see that legislation come in, and the European Court of Justice is currently considering the issue because some parts of the drinks industry have objected to this law. They want to retain the right to sell cheap alcohol. We think that's very harmful to health, and we're looking for support from European institutions in our campaign to get rid of these products. It's an important health policy because alcohol is a very important determinant of health, and particularly for the heaviest drinkers, the cheapest alcohol is a very important issue. If alcohol is very cheap, then the heaviest drinkers buy much more of it. They drink even more than they would normally, with considerable harm to their health and of course to their families and to people close to them. So we're very pleased when the Scottish Government agreed with us that action needed to be taken, and we're looking for Europe to support Scottish doctors and the Scottish Government in tackling these problems. Most of the products we're talking about are produced in the United Kingdom. These are not imported products from outside of the country. So this is not a trade restriction. We're a health body, our main interest is in improving health, but we've heard this argument from trade bodies and it's just frankly untrue. The cheap vodka we're talking about is made in the United Kingdom. Much of Smirnoff vodka is made in Scotland. That surprises people. It sounds as if it might be from Poland or from Eastern Europe, but in fact it's made in Scotland. The cheap vodkas that we find in our supermarkets are made in the United Kingdom. So this will predominantly affect products made in the United Kingdom, and it's not there's no evidence to suggest it's a trade restriction. If alcohol becomes very cheap, you can do the best education programme in schools that you can possibly deliver. If those children then go out into a supermarket and see alcohol piled high and sold cheap that they're able to get their friends to buy, that they can then afford and drink, that will undo all of the good work that you do. So controlling the price of alcohol is absolutely vital in allowing the other mechanisms, the other health education and treatment activities to work properly. I think if the European Court of Justice says that trade considerations override health considerations, I think that would be a very disappointing judgment, and many people who are at this conference, who are public health advocates in Europe, will be very disappointed by that judgment. So what we want to see is the European Union and its institutions supporting member states to do things that are the right thing for their circumstance, that prioritise the health considerations and to support Scotland in their attempts to do that.